Strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to your Hometown Health Show, brought to you by Trilogy Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Hello.
I see you. Hi, Leslie.
Hello.
Good evening. Welcome to our Hometown Health Show. I'm Jennifer Smith. I think we're waiting for Yolanda, but in the meantime, I'm one of the show's sponsors. We can be heard live this evening on 1470 AM, 95.3 FM, 96.9 FM, 103.9 FM, and we are streaming live on Facebook. And this evening, hopefully Yolanda will be joining us shortly. I think she may have gotten kicked off. But we want to re-welcome Leslie from John Knox Home Health. Welcome back, Leslie.
Thank you.
And we have Danielle also joining us from Trilogy.
Hi.
Hi, Danielle. Do you want to say a little bit about Trilogy Home Health before we get started with the questions from Leslie?
Yeah, well, first of all, I just want to let you know that we at Trilogy want you to know, as a skilled Medicare home health provider during this global pandemic, to provide the best and safest possible nursing and therapy to you and your loved ones. And we cover right here in Broward County, except Miami, and most of the state of Florida, all the way up to Jacksonville.
Great. Well, again, thank you, Leslie, for coming back to our Hometown Health Show. We're very excited to have you back. Why don't you remind our listeners a little bit about yourself and your role at John Knox Home Health?
Okay. I am the administrator of our home health program, which is a very, very large licensed only home health, which means that we provide private duty services to clients wherever they need them, whether that's at home, in the hospital, or in a skilled facility. And in addition, I'm responsible for the wellness nursing team. And here at John Knox Village, that's a 24-hour nurse team that does triage on campus here, as well as our social workers. So I have a lot on my plate.
I would say so.
Yeah.
Yolanda, so glad you could come.
Yes, sorry about that. Sorry for the technical difficulties. Welcome, everyone. And again, I'm Yolanda, and you're listening to your Hometown Health Show. Welcome, Leslie, our special guest of the evening. And we have Jen Smith, as well as Leslie Schlinger from, Daniel Thomas from Trilogy.
Yes. Yeah. So I already just asked Leslie to tell our listeners a little bit about herself. And the next question, I guess she can just tell our listeners a little bit about this is that John Knox Home Health provides.
Well, we provide all the traditional things that one might need assistance with. So that would be personal care, if someone needs assistance with bathing, dressing, any of the normal things that a person who might want to do for their normal day and is having some difficulty because of either illness or weakness. We provide aids in the home or wherever the person lives to assist them with that. In addition, we have a very, very strong focus on the social aspects of life. So we pride ourselves on having caregivers that enrich the daily experience of our clients. So that means that they will do extra special things like take them to church on Sunday, grocery shop for them, take them to the grocery store or doctor's offices so that they can do all the normal things that adults need to do. And in addition, we're in this pandemic also taking care of people who may have to self isolate because they've had an exposure. And so we've been doing quite a bit of people through that process and having them come out well on the other side of it. So that's a good thing that we've been doing.
Nice.
In addition, we have skilled care that we do in the home. So that would be when people need assistance with medication management. They may need a med box filled, or they may actually need nurse visits for administration of medications. So we do both of those type services. And we have individuals who sometimes do not meet some of the Medicare criteria, and we will help them with nursing skills in that way. For quite some time now, we have partnered with Trilogy so that the residents that we take care of that do need Medicare services and qualify for them have the finest partner we could find.
That's great. Okay. So, as you know, are you still in the office?
I am.
Oh my
She
goodness.
is.
Cheers to you. Yeah.
Mhm. Well,
So
that's
as
not
you know,
so unusual.
yeah, I mean, especially in this field, right? So with the
Right.
pandemic, can you tell our listeners the steps you're taking to help keep your clients and staff safe?
Well, the most important thing, and I tell my staff this too, your most important safety item is your brain. So you have to think clearly about what it is you're trying to accomplish. And in our case, we're trying to keep a bacteria or a virus from getting to the client. And if the client has already got signs and symptoms or has a confirmed viral condition, we're trying to contain that so that it doesn't spread anywhere else. So to do that, you have to have what they call PPE, and that stands for personal protective equipment, which really means gloves, masks, gowns, face shields. And those are the pieces of equipment that are used whenever we take care of a person with an infectious process. So the demand for that has increased tremendously with this pandemic. But those pieces of equipment are not new to us. We have been using them for years and years in healthcare to keep people safe whenever there's an infectious process that happens. So, typically people might think of the epidemic or the pandemic as something new that we've never experienced. But those of us in healthcare are accustomed to having to use the right equipment when we take care of something that could infect someone else. So we spent a lot of energy making sure that our employees who may not have been up to date on using these things were refreshed and educated in how to use them properly, how to put them on, how to take them off, how to dispose of them properly. So that was one of the very first pieces. The second is we started limiting the number of direct contacts unless there was an appropriate reason to do it. But that meant we had to increase the number of phone calls that we had to make sure that people were doing well so that we didn't have unnecessary contact, but that we were making sure that if it was truly necessary, we had all the right equipment to do it. So that it sounds simple, but it's not simple because when you take care of 150 clients, you're talking about lots and lots and lots of employees and lots of equipment. So one of the things that we were very fortunate to do was that in early January, when we started to hear this talk about a pandemic, we got on the horn and ordered equipment immediately. And it was good that we did that because equipment is now coming in, but the turnaround time is about 3 weeks out from what you order. So we were fortunate that we had some already, and then we placed orders early enough so that we created a closet full, and then we monitor the use of it so that we develop what you call a burn rate, and you figure out how much you're going to go through based on your estimated need. And so we continue to replenish that stock based on our usage so that we are able to provide all our caregivers with everything that they need. And that's been a godsend, because I know that there are many agencies out there that did not see this coming as early as we did not take the actions that we did, because it was a decision. You have to decide up front, are you going to spend the money for something that you're not really sure you're going to use? And then it's a gamble, because most companies don't have 500 gowns in the closet and 5,000 masks in the drawer. We did all of that, and it has paid off. We have been very, very effective. We have not had a single positive case in our home health
That's great.
clientele.
Knock on wood. Wow.
So it is very good. But I do think, due to the due diligence that we did, and the teaching, and that 20-second hand wash over and over and over again. So that's what we've done.
So I want to remind our listeners you're listening to your Hometown Health Show, and we have Leslie Schlinger from John Knox Home Health. We're going to be right back, and as soon as we get back, we're going to talk about hiring practices and what people should think about. We'll be right back after this commercial break.
Trilogy was established in 2016 by industry experts with over 30 years in home health care operations spanning 30-plus counties throughout the state of Florida. With offices in Jacksonville, Port St. Lucie, West Palm Beach, we strive to provide the most optimal care to our patients in a fun, forward-thinking environment. Our focus is on personal relationships, whether with an employee, a patient, or an outside community. Because we know that when people enjoy what they do, it becomes why they do it. Call Trilogy today at 954-689-6660 and ask for more information. In addition to offering the standard mix of services, SN, PT, OT, speech, MSW, and HHA, we also take great pride in being on the cutting edge and offering care and education to our licensed clinicians in other areas most agencies likely don't offer. Emotional and behavioral health with our psych nursing, biofeedback for bladder incontinence and pelvic pain, chemotherapy, IV hydration, antibiotic and respiratory therapy. Call today at 954-689-6660. Trilogy Home Care. You have been listening to the Trilogy Home Health Show, and if you wish to be a guest on our show, please call us at 561-670-9213 and let us share your knowledge and information with our listeners. Trilogy Home Health Care Show enjoys serving the community and bringing doctors and facilities of interest to help educate and inform the community. Please call us at 561-670-9213 and let us put you on the airwaves with the Trilogy Home Health Show.
Hello, everyone, and good evening. You are listening and watching your Hometown Health Show. I'm Yolanda Santana, your host for the show. And we have here Jen Smith from Trilogy, as well as Danielle Thomas from Trilogy, as well as our sponsor. Our special guest this evening is Leslie Schlinger from John Knox Home Health. Welcome again. And we were just about to get into, if a family was interested in hiring a private duty company, what are some safe hiring practices that they should consider?
Well, in this day and age, people have some choices that they have to make when they're going to hire a private duty aide. The safest way to do it is to use a licensed agency. That's what John Knox Home Health is, because we're regulated by the state and we have the highest level of criteria So when you use a home health agency, you're hiring a company that's going to provide you with their own employees that are screened and usually drug tested, and they have a level 2 crim check. And these are requirements that agencies are obligated to follow. The other option that you might have would be a registry. That's also a regulated industry. It has a little less oversight in the environment of the home because, in fact, it's kind of a brokerage where an individual goes through that entity to find a caregiver, but they retain the responsibility for directing that employee. Whereas in an agency such as ours, we supervise the employee. The third method, which I actually do not recommend at all, is that you can hire privately. And there are plenty of people out there that are looking to hire private caregivers because they think it's the least expensive model for them. That is only true if you're looking at the actual hourly dollar amount. But when you hire privately, the law actually declares that as you an employer, you're supposed to retain and file taxes on a quarterly basis, and failure to do so puts you at risk or puts your estate at risk later when people might want to go back and claim that they were not handled properly as an employee. There are quite a few employment laws that people can choose to ignore, but it puts them at greater risk. So when you want to select someone, it's always best to select an agency.
Yeah, I've
Okay.
also worked, I've also seen in situations that people will recommend their neighbor, and let's say the neighbor calls their person they're working for, and then they just can't work that day, and then that poor elderly woman is stuck with no help that day, and there's no one to fill in. And at least with a company like John Knox, they someone that can hopefully quickly replace
Correct.
that person.
We can
Um,
replace them with a competent caregiver. Yes,
Absolutely, it's
absolutely.
definitely a safer
So
option. Or
it is
and you don't know who
safer
you're going
and
to get. Hmm.
exactly. So that is true. Also, when you work with an agency, we know what the standards are that the state of Florida wants to hold individual providers to. So we know what's appropriate that a nurse does, what's appropriate that an aide can do or cannot do. And to keep their loved ones safe, we want everyone working within their own scope of care. So that's a big piece of the safety as well. Also, if you hire somebody and they're your employee and they cause an accident or an injury, perhaps to your neighbor, and they might be well intentioned, no one causes these things on purpose, but your neighbor could actually sue you and say you're the employer and you're responsible. So there are some considerations, and cheap is not always the cheapest in the long run.
Right. So for those out there that are still considering, and why, I mean, after all of that, why would they even consider? Also, what's the difference between Medicare and private duty?
Well, there's a big difference there. And the big difference is who's going to pay for it. Medicare is a benefit that is still covered under their Social Security benefits and in home health. Although we don't know how long at this point, it's usually still without a copay. Private duty, on the other hand, are services that Medicare does not authorize. And they may be very similar, they might be exactly the same services, but because of criteria that the government has established, the person doesn't qualify for Medicare. So they will have to pay out of pocket for private duty care. So that's a distinction that when you work with entities that know the difference and know it well, we can maximize that you get what you're covered for from Medicare, and then we transition to private when it's time to do that.
Definitely. And then how else can people pay other than out of pocket? Is there any other benefits that they can tap into?
There are. There are veterans benefits out there that some veterans and their spouses may qualify for, and they will allow them to have help in the home that's paid directly by the Veterans Administration. There is criteria for that as well. It's both financial and how much out of pocket expense the individual, the veteran, or the spouse is already paying for their health care. In addition, some people have long term care insurance, and long term care insurance is very specific to the policy that the individual has purchased. So, some people have coverage that allows them a couple of hours a day. Other people have coverage that allows them 24 hours a day. It just depends on how large a policy they purchased.
Great. Thank you for those explanations. If you could give us an example of how you work with Trilogy.
I can give you an example of that. If we have an elder that we take care of that perhaps has a fall or an illness that is giving us the opportunity to provide nursing supervision or physical therapy or occupational therapy, and sometimes new medications or new diseases will be a source of a need for education for the individual, then we will reach out and contact Trilogy, because they're the Medicare agency, and let them know that we have an individual that would benefit from their services. We collaborate by getting doctor's orders, because the Medicare team always has to work underneath the doctor's order. And then they will come out and assess the patient and determine, does the patient meet all the criteria that Medicare requires, and do they have services that match the patient's needs? And in my experience, Trilogy always has services that match the patient's needs, because they have a pretty robust scope of service. And so they will come in and service this patient under their Medicare payer. And that's a wonderful thing for the patient. And then as the patient is getting better, they will transition back some of those pieces to us that the patient may have to pay for again, because they've gotten better and they no longer qualify for Medicare services. So in that regard, we approach the person from a very holistic way to see that we can provide them everything they need with the least out of pocket expense. But we know that there will be some, and we partner for that.
So Leslie, how can someone get a hold of you? If you can please let everybody know.
Well, that's very simple. We have one phone number, and somebody would answer it 24 hours a day if you needed help. Although if somebody just wants to ask a question, I would hope that they would call during business hours. But it's 954-783-4009. And that's 7 days a week, and even on holidays, same number.
All right. And do you have a website?
We are in the process of updating our website. So at this moment, I would say that's not our best source of information. But after hours, a nurse will answer the phone.
Thank you so much. Thank you to all of our guests. Thank you, Trilogy, for us being your
Thank
sponsor.
you.
Thanks,
Have a
Leslie.
great day.
A pleasure.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Let's all welcome a new sponsor to the show. It's AMP2TV, the first and only internet production company that's truly plugged in. When you're looking for a full-service internet, TV, radio